Bismillahirrahmanirrahim. Assalamu alaikum. Today our topic is tuberculosis. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects lungs, but it can also affect other parts of the body such as the kidneys, spine and brain. Here's some information about tuberculosis. Causes. Tuberculosis is primarily caused by inhaling tiny droplets from the coughs or sneezes of an infected person. It is a highly contagious disease, but it's important to note that not everyone who is exposed to the bacteria becomes infected. Factors such as the strength of an individual's immune system play a role in determining whether the infection will develop. Signs and symptoms. The signs and symptoms of the tuberculosis can vary depending on the site of infection and the individual's overall health. In some cases, the infection may remain latent with no noticeable symptoms. However, when active, tuberculosis commonly presents the following symptoms. Number 1. Persistent cough that lasts for more than 3 weeks. Number 2. Coughing up blood or sputum. Number 3. Chest pain. Number 4. Fatigue. Number 5. Fever. Number 6. Night sweats. Number 7. Unintentional weight loss. Number 8. Loss of appetite. Preventions. Preventing the spread of tuberculosis involves a combination of strategies. Vaccination. The Bacillus calmette-guerin BCG vaccine can provide some protection against severe forms of tuberculosis, particularly in children. However, its effectiveness in preventing the most common form of pulmonary tuberculosis in adults is limited. Infection control. Isolation and separation of infected individuals, good ventilation systems, and proper respiratory hygiene, such as covering the mouth and nose when coughing or sneezing, can help prevent the spread of tuberculosis. Screening and treatment. Early detection of tuberculosis cases through regular screening, especially in high-risk populations, is crucial for effective treatment and reducing transmission rates. Treatment. Treatment of tuberculosis typically involves a combination of antibiotics taken over a prolonged period. The most commonly used drugs include isoniazid, rifampicin, pyrazinamide, and ethambutol. It's important to complete the full course of treatment as prescribed by a healthcare professional, even if symptoms improve, to ensure eradication of the infection and prevent the development of drug-resistant strains. In some cases, drug-resistant forms of tuberculosis may require alternative or additional medication. Treatment for drug-resistant tuberculosis is often more complex and can involve a combination of different drugs taken for an extended duration. It's important for individuals with tuberculosis to follow their healthcare provider's instructions, take medications regularly, and attend follow-up appointments to monitor their progress and ensure successful treatment. Please note that while I strive to provide accurate and up-to-date information, it's always a good idea to consult a healthcare professional or trusted medical source for specific medical advice or concerns related to tuberculosis.